Hi, this is Dr. Chris Wilson, physical therapist with Think PT, here at our offices in Centerville, Ohio. Today we're going to be talking about self-traction. So over here, I've got what we call a little functional fitness band. There's different sizes, widths, for different sizes of pole or different widths of the band. For this purpose today, I've got kind of a medium width here, and we'll show you more about why. Also, you'll notice it's attached to the door. So I've got it attached to the door so you can see I've got a nice pull, it's not going anywhere. The door closes this way, pressing up against the door jamb, so it cannot pop open and have anything happen adversely, all right? So as we talk about this, it's important to recognize that this is a medical treatment. It should be discussed with your medical provider. They would go over how to do it safely and effectively. The reason that I'm sharing this today is a lot of people don't realize that they can do traction of their cervical spine at home relatively simply with very little equipment. Most people, if they're going to do it, have to buy some fancy equipment with an air pump or other kinds of features. This will work pretty well for most people. Again, we are talking about the neck. We are talking about pain and injury and relieving that pain. You do want to get cleared by your medical professional. This is something you would discuss with them, right? If you don't know about it, you can't ask about it. You can't get instruction on it. But if you do know about it, which is our purpose here today, to educate and inform and encourage the discussion, then you too can see if this is something appropriate for your care, for your neck and your health. So what I'm going to do, you'll notice when we get started, where I'm aiming to put this band is it's going to capture the base of my skull. All right, it's going to wrap around kind of where my glasses wrap around my ears. That's where it's going to come up and through, and it's going to have a nice gentle pull on my neck. All right, so we'll go ahead and get started with it. So I'm going to put it again around the base of my skull here. You'll see it comes up and around my ears. Hopefully you see that coming up through there. And it's going to get a nice, it's going to really kind of capture my head right in there. And I should just be able to relax nice and good. You may take just some little self-adjustments there periodically. Get comfortable with it. And I should again be able to relax. Nice, easy breathing, gentle breathing, relaxing, letting that neck just collapse down and allowing the band to take all the way to my head. All right, and in order to get a little bit of force through that head, and again, this is the reason why you want to make sure you're checking out with a medical professional to make sure there are no red flags or yellow flags against you doing this, areas of caution, and to ensure that you don't do too much force through your neck, you want to get them to supervise you the first couple times. But once they do it, what you would do is you just walk out just a little bit until your head's just barely off the ground, right? And again, I can just really relax here and let that band kind of pull back. Now you'll see I'm a little bit at an angle with the door here just because of the nature of the room. You'd want to have your body directly in line with the line of pull of the door handle and of the functional fitness band to really make sure you've got a nice symmetrical and even pull through your neck. But that's it, you'll just kind of stay here. Again, your healthcare professional can tell you about what the on-off cycle of traction should be. All right, if you're in an actual clinic, they may have a device that's electronically controlled to cycle it on and off. If you're at home, you may have an air pump system in the traditional versions that you have to then pump and then release, pump and release. Whereas here, you just scoot back, relax, and then you just scoot forward a little bit until you feel that nice gentle pull. Hold it there for just a little while. Again, just really trying to relax the neck while it has you there. And then to release and take that pressure off, that pull away, you just scoot back. Very, very simple to do. So you just scoot down, and you increase that pull, and you scoot back again. Don't try this without first talking to your medical professional, but if you're having neck pain, perhaps even some neurological symptoms, some numbness and tingling into your hands, carpal tunnel-like symptoms, this is something to discuss. It's very simple, easy to try, very low cost, low threat, and you can rule out some more intensive procedures with this more basic one first. Again, this is Dr. Chris Wilson, physical therapist with Think PT, here at our offices in Centerville. Thanks for watching.